But I want to talk today is about the difference between ligaments and tendons, because it's essential if we talk about healing of these structures that we know what they're supposed to do. So if I turn this horse around, we can see the inside of the leg. One of the main ligaments we have to deal with in equine sports management and injury is the suspensory ligament. Now, the suspensory ligament sits here at the bottom of the knee and stretches out to basically the back of the fetlock through two branches. Now, the difference between a ligament and a tendon per definition is that a tendon would connect a piece of bone with a muscle so that there's mobility, and a ligament would attach bone to bone. So bone here, bone there. As a result, or functional anatomy would dictate that per definition a ligament is less elastic, which actually makes it harder to heal. In order to get tissue to heal, we need a certain amount of loading and elasticity to be functional. And to get a ligament to heal, it actually needs relatively more exercise, more loading, nearly than the tendons do. And I think that's one of the reasons why we struggle in equine rehabilitation to get that right. Because in order to do enough exercise on the ligament, we nearly do too much so that we're afraid to break it. Now, and that's whoever gets that balance right has a successful rehabilitation process. But a suspensory ligament injury, a check ligament injury, a suspensory branch injury has a different approach to the loading it requires and the rehabilitation protocol that we need to apply than a tendon has.